Okay, go ahead, Brenda.
Hi, my name's Brenda, and Nick is my 12, soon-to-be 13-year-old boy, and he is the second of our children. I have a 19-year-old daughter who does not have any developmental delays, but Nick does. Nicholas was born in December of '96, and when I was pregnant with Nicholas, I didn't know that I had anything wrong, but we did have some medical issues that I guess I wasn't too concerned with, but the doctors did monitor us during the last 3 to 4 months of our pregnancy. We did know that Nicholas was going to have issues when he was born. They did take him approximately about 2 weeks early by cesarean. He was breech, and that's the only thing I thought was wrong, is that I've got breech delivery here, I'm going to have a cesarean. But he was failure to thrive is what the doctor had indicated to us, which to me, as a parent, unknown to all these issues, thought my son's going to die. The one thing I wish the doctors would have done differently is to tell us what failure to thrive is when they walk into your room, instead of scaring you to death. But we did stay in the ICU for approximately about 3 to 4 weeks. Nicholas would not drink very well, couldn't open his eyes, and all that was low muscle tone. He just didn't have the muscles to even open his eyes for a while. Nicholas did have a lot of medical issues during his first 2 years. We struggled as a family new to these health issues. I didn't know if he had a syndrome. We didn't know if it was just a health issue. We just were focused on keeping him alive. And so the first 2 years we fed him 2 ounces every 2 hours, rocked him. We had to hold him for an hour after feeding because he'd get sick, and then feed him again. So it was a round-the-clock care, and you learn to appreciate family more, because you have to have all hands on deck. It was grandma, it was dad, it was everyone taking their turns in the care of the kids at first. As far as Nick's diagnosis, he's labeled global developmental delayed. They did genetic testing, and none of the known syndromes fit Nick's condition. They did say cerebral palsy. They got that on his file basically to give him some type of a label which will qualify him for some assistance with medical bills and things like that. As far as one of the things that we had issues with is we had our primary health insurance, but after a while your health insurance doesn't cover a lot of the extra equipment that you need for your special needs kids. And you get a social worker assigned to you, kind of, per se, when you have a special needs child. And your social worker is your little black book of knowledge. She will give you names and telephone numbers and resources, and you have to use that black book of knowledge. The best thing you can do for yourself is to use those social workers, ask them questions, and ask for help. Find out what companies can assist you with the equipment, what type of programs they have out there, and to use those. We've got in Nebraska, it's called a waiver program, which will help you with, besides your medical insurance, it will help you cover some equipment and things like that. And you have to not be too proud to fill out that paperwork and to accept some of that assistance. They call it respite care, as far as you can have someone come into the house and to help you care for your child. You're allotted so many hours a month. Take advantage of that if you get a chance to, parents. If you know of any families who don't have it, to encourage them to use that, because as a family struggling with trying to survive with the diaper changes, the medical issues, the respite's the best thing you can do for your family, is to just step back, breathe, let someone else help you once in a while, and then start back the next day with your same issues over and again.
How much respite care do you get?
You know, it's government is constantly looking at cutting back, and this is one of the places they were. They will give you about 2 days a month, and it's not 2 full days, it's like 2 6-hour days.
So where is Nick during that time, or does somebody come into the home, or?
There are services out there that are available. Nick goes to Children's Respite Care Center, which is one of a couple of them here in Omaha. The Respite Care Center does provide child care before and after school, and they also have some weekend care, which I don't have enough in me to give them to them overnight. They'll even do overnight care. So if you have a wedding out of town or something, if you need overnight care once in a while, they have that services available for you. But as a mom, I can't do that yet.
So you take Nick with you on vacation and all of his equipment and
We do.
special foods?
Yeah.
Because you've mentioned that he has a feeding tube.
Nick has a feeding tube because for the longest time he could not swallow foods enough. He could not eat enough to sustain himself. He would actually grow tired after eating just a little bit, or he couldn't swallow enough, he would gag. So he does have a feeding tube. It's a G tube. He did have reflux, as Dad's mentioning, which is after he would eat so many calories, he would literally, it would kind of come back up into the esophagus, and sometimes he would actually throw it up, and he just couldn't keep it in. And with that, he did not have enough energy to go through the therapy classes that he needed. And so by doing the G button, we were able to sustain him with extra calories through an Ensure through a G button tube. Today, and after many years of continuing have him with mashed potatoes and jellos and the soft foods, after 13 years he's eating pieces of steak, he's eating potato chips, he's eating almost anything that we have at the table. And so we were afraid of that G button, afraid that, you know, it's an easy way out to get calories down you. But you have to keep working at the oral foods that he enjoys eating with us now. But he still has to have the G button for extra fluids and extra calories. And it keeps him out of the hospital quite a bit. So this is probably the first year, about the last 2 or 3 years, where he hasn't been sick enough to where we have to put him on a constant feeding tube at least a couple times a year because he gets sick. Most of these kids with developmental delays, with the extra health issues, tend to catch more. If someone's got a cold, they're going to catch it. Someone's got the flu, they're going to catch it. So they miss a lot of days of school. The parents miss a lot of days of work. And by keeping them healthy, it's the best thing that you can do for them and for you, and overall the doctors and the shots and the flu shots. And at this time of year, it's our worst fear is that he's going to catch the flu and he'll be down for weeks. Okay, and as far as caregiver stress, it's very stressful because by the time you get up in the morning and you're lifting him out of bed and you're brushing his teeth and you're combing his hair and you're just going through the diaper changes, and when they're 13 and changing diapers, that's a whole new type of diaper. But and we wonder how many years are they going to be in diapers? Will he ever come out of diapers? All those things, all those different feedings and the medicines and the grinding the pills and the different medical issues that they have, all those health issues is something that lays a lot of stress on the family. And one of the things that I would suggest if you have siblings is to try to spend special time